Hi, good morning. This is Dr. Ravi Teja Rudraraju. I am a complex knee and a sports medicine surgeon at Apollo Jubilee Hills. Today we have Mr. Balaji with us. Balaji has met me I think 2 months ago with his injury to both of his ankles. So he's a very passionate bike rider. He keeps going on trips, long distance trips on bikes along with his friends. Unfortunately, in one such trip, when he is coming back to Bangalore, he met with a small accident and he had fell off from the bike and injured both of his ankles. So as a part of sports related event and sports injury, he reached out to me asking for help. So I consulted him on a phone, and then I requested him to come to Hyderabad to our hospital. So he came to me and I examined him, and I suspected to have a high grade sprain to his left and right ankles. So I got an x-ray done for both of his ankles, and unfortunately he sustained fractures on both the fibula, distal part of the fibula, which is the bone next to the tibia in the leg. So the left one was not really a displaced fracture, like it was in place. So I planned to treat him conservatively by putting a cast on the left side, but on the right side he had a high degree sprain or a high grade sprain for his lateral malleolus, and he had a fracture for his fibula. So we discussed all the options. Since he is a young guy, he would like to continue his bikes, going around with his friends for bike trips, and is very passionate about it. So since he is expecting a very active life after the return after this injury, we decided to go ahead to fix the lateral malleolus fracture. Also planned for further interventions with regards to the ligaments that can be injured during the sporting activities. So we went ahead and fixed it, and now he is with us after 6 weeks. I'm very happy with the outcome of how he is performing today. He walked into my clinic without any support, and he is pain free and he is comfortable with whatever is the journey in the last couple of weeks. Now let's hear from Mr. Balaji. How was his journey and how was his experience, and what is he looking forward to after this whole recovery process?
Yep.
So please, Balaji, walk us through your
Sure. Doc has covered majority of the journey anyway. But the thing is that I got to know about him through my sister, who's again a passionate cyclist around here right now. So apart from me riding bikes, I am an enthusiastic runner and as well as a cyclist too. So I had a very clear thought in my head that how I wanted my recovery to be, and that's what I conveyed to Dr. Ravi very clearly more than once, that once the surgery is done, I don't want to again go back to having a stiff ankle or anything, because I need to go back to running, yoga and cycling and everything. I think he had kept all of that in mind and taken the best possible the best treatment which needs to be given in such situations, and that's what the surgery had been done. So it's been almost now I think it's 6 plus 6, it's near about 3 months almost, I guess. Yeah, it's almost 3 months now, because I had this accident in August, and so September and October, and now we are in November. So I think the recovery has been going on also pretty without any hiccups. It's been going on pretty smooth. I'm just being extra cautious because he had given me all the things which I need to be prepared for. Even more specifically about not hurrying up into the getting into the movement without taking enough care. So I've been following even those things as well. Yeah, I mean, sitting at home, for me, a person who keeps roaming around becomes a little bit difficult though. But he had given me the knowledge enough, that, if you spend at least this much time right now, later on in life, it will not be affecting pretty bad later. So that way, I think it was guided very well and always approachable, and he's always there, for us to guide us. Even initially when we were here, we had a little bit of a things with the insurance and all, which he helped sort us out and all of that. So I think overall, the experience had been, holistic and holistically very good. And right now I'm just looking forward for getting back on my feet. I mean, I'm already on my foot. I know, walking around with all his suggestions. So I mean, we enjoying his treatment quite a lot, and definitely would be suggesting to as many as I can. And yeah, so that's it.
Great.
Mostly.
Thank you, Mr. Balaji. I'm sure people who are watching definitely know the kind of burden how an injured ankle or a knee can put people away from their active life, and nothing to worry, or really not really a big deal if you understand what's the injury, how to deal with it, and what are the outcomes after this kind of a problems. So any of you guys having any of the knee injuries with related sports or ankle or shoulder anywhere, I think we are here to help you at Apollo Jubilee Hills. Please do come and see us, and we are happy to help you get back to your life and live actively and happily. Thank you.
Yeah.